The gentleman from Ohio is recognized.
Thank you, Mr. Chairman. You go, Bill. I'm deeply concerned, Mr. Secretary, with the state of health services and human services in our country. I continue to hear from providers across the country, which I was one for 3 decades. They're closing their doors, walking away from providing care to patients every day because of the challenges that have come from this administration and because of some of your decisions, sir. Physicians are the ones that continue to show up to the front lines and make sure that patients receive the care that they need. Doctors are the ones who provide the health and human services to patients across this country. And if this pattern continues, there won't be enough doctors left to take care of patients across America. Your budget grows, you treat no one, you're a lawyer, and you ask providers to do more with less until they close their doors. Congress spent years negotiating a solution to solve surprise billing and do it in a balanced fashion. And yes, we took patients out of it. That we did. Congress passed the No Surprises Act to protect patients, create a balanced process. The president signed it into law. You ignored that. And we created a bill that created an incentive for doctors to want to be in network and for insurance companies to want doctors in network. But you decided to implement the law in a manner that unfairly tips the scale in favor of insurers by placing undue weight on the qualified payment amount, which was just one component of arbitration and did not have weight over any others. You directly defied the law as written, and it's interesting, considering that you're a lawyer, that you would violate the law. And your illegal actions have led to a backlog of claims, and you called the claims recently to be frivolous. Well, you asked the patients that got the care if it's frivolous. And you asked the doctors, they have to pay their staff and their salaries and to stay open and to be in the black. You asked them if it's frivolous. You said patients aren't affected. They are affected. Doctors retire or they quit taking call. You come in that ambulance and guess what? There's no doctor on call because of the way you have implemented the No Surprises Act. You. So you're directly harming patients, actually. Doctors and hospitals need to be in the black to keep their doors open, to continue to provide a service, and they can't pay their help if they don't. What this says to me is you clearly don't value the work of physicians and surgeons and what they do for those in need, and without them, we have no health system at all. Mr. Secretary, will you implement the No Surprises Act as written in statute and not stray from the letter of the law as you have continued to do, as you have been informed that you have done by the courts, and maybe get out of the courtroom and into the emergency room and the operating room where HHS belongs?
Congressman, I respect especially the passion with which you speak to the subject. And so what I will tell you is where we've gotten guidance from the courts, we have followed it. We will try to do the best we can. If you were one of those who helped pass the law, I thank you. You probably remember when that was being discussed, I think at that point people thought 10, maybe 20,000 disputes would be sent for this independent dispute resolution process. In the first 8 months, 164,000 claims were filed.
But you're responsible for that, sir. The way you have implemented the law has driven this. You took away the fair process.
Congressman, there's nothing
so of course they want to go to arbitration.
Congressman, there's nothing that we did.
You called it frivolous, which is an insult to every provider out there.
I'm not calling it. It's the arbitrators. The arbitrators are the ones that are saying that those were frivolous claims.